Let me tell you a little bit about the context. I won't talk much about the foundation. I think most of you understand, who we are, what we're up to. But one of the three strategic priority areas that we make grants in and have committed to try and be a positive force in is tackling the diabetes epidemic that our state faces and so many other states across the country face. And so we've really tried to fashion what we're calling our diabetes campaign that would take to scale statewide, across the state, the idea of the chronic disease model and the chronic care model, and trying to transform practice of clinicians so that we can improve the care the people who have diabetes get. And then a second part of that diabetes campaign is to work with community-based organizations and community forces to try and do the primary and secondary prevention that will help reduce some of the need for medical care for diabetes, trying to get people to exercise more, eat better, try and grapple with some of the environmental challenges to make those choices easier to make. And so we're working on both the clinical side, the public health community prevention side, and then thirdly, the campaign has an intense interest in the policy side of saying what types of payment policies, state policies, do we need in order to encourage the first two activities, better clinical care management, better public health prevention activities. And so we sort of working on that, and a lot of that is directed at the major payers, which are the insurance companies, the health plans, the state, and so on. And I think as we talk, you'll see that the whole financial side, the incentive side, and the clinical side, gets mushed together pretty quickly. You can't do one without the other. So that'll come into it. And the approach of our campaign is we've asked Neil Kalman from the Institute of Family Health to be the director of this campaign, the leader of the campaign, and his, he has a staff that we're supporting to really make this happen on different sides and sort of a organizational sense. But we've very importantly reached out to some partners all across the state to really be the intermediaries to work to identify the physicians, to identify some of the community groups that we could encourage to change. And so we've reached out to organizations like the Community Health Center Association of New York State, the Hospital Association of New York State, the American College of Physicians, Family Practice Organization. So, various intermediaries that are helping us engage individual physician practices, and we include both community health centers, other types of health centers, outpatient departments, and private practice of varying sizes. So we're interested in all that. We're interested in doing it statewide. So I know some of you are very much engaged in that campaign, and we appreciate it. The other part of the campaign that we're just sort of starting to think about, and Neil and I talked about, and Jacqueline and others, is we really need to think of it in terms of partners. We need to sort of reach out to other organizations to get them to work with us on this, so it can not be just our foundation, but just a lot of organizations in this state.